if you have high blood pressure, what are some of the things that you feel in your body? These are things that are supposed to communicate to you that, oh, you need to go get your blood pressure measured or checked out. And but before that, I want to make mention of a very important fact. We call high blood pressure or hypertension a silent killer. Why? Because you can have hypertension, you can have high blood pressure, and you don't feel anything at all. Only to wake up in the morning and you've sustained a severe complication. Those are people that die suddenly. Maybe you went together to bed with someone in the night, and by morning they are dead. But before bedtime, they were okay, you were jazzing, they didn't have anything at all. So someone dies suddenly or sustains a severe complication suddenly. Someone who was okay, someone who woke up very fine, did his work, did everything, but by 6 p.m. they are dead. They are nowhere to be seen. That's why we call it a silent killer, because it can take your life when you don't know. It sometimes doesn't warn us, or the warning might come, but it might be so sudden that there is little that can be done to save your life at such a time. And that's why we have to be more vigilant, because if it's not for the vigilance, someone can live with high blood pressure for 5 years, for 10 years, for 20 years, but when they have no idea. So, as for some people, they get certain symptoms. Now, it is also tricky because some symptoms that people get are sometimes brought about by things other than hypertension. That's also so problematic. For example, if you have hypertension, you can get light headache. Usually in the morning, someone says, every morning I wake up with this stubborn headache. But when I take a painkiller, or when I rest, or when I start to do my activities, the headache actually resolves. It might be an indicator that you have a headache, in as much as this headache can be as a result of any other thing. Some people start to feel the heartbeats. Under normal circumstances, you're not supposed to be aware of your own heart beating. But if your blood pressure is high, sometimes you start to feel your own heart beating. Some people get a bit dizzy, a bit of dizziness. Some people get nauseated, and others actually go ahead to vomit because of a high blood pressure. Some people get a bit of blurring of vision, and others get tingling sensations or sounds, funny sounds, or even a slight loss of hearing, but commonly a bit of tingling within the ears. If the blood pressure is so severe, it's so high, some people get confused and others faint. You can get confused, you can faint as a result of a very high blood pressure. Some people bleed from the nostrils as a result of a high blood pressure. Others become a bit anxious, anxiety, where you feel like you have done something, or you feel something bad is about to happen. You start to suspect an impending doom. You start to feel like that's anxiety. It might be because of hypertension. Talked about the confusion, and some people get muscle tremors, tremors, that uncontrollable shaking of the muscles, chest pain. That pain is usually in the middle of the chest. There is a bone around here called the breastbone. Medically, we call it the sternum. Sometimes you feel pain behind that bone in the middle of the chest here. Sometimes that pain is squeezing. You feel like something is squeezing you up. And then sometimes you also feel it going to the back, sometimes to the shoulder or to the neck. that pain sometimes is as a result of the high blood pressure having its effects on the heart. So those are some of the things that you feel when you have a high blood pressure. But like I said, you can have that high blood pressure and you don't feel anything at all. So if you get any of them, you should really take precaution. You should make sure your blood pressure is measured, so it's established whether it's high blood pressure or other things. And if you have never felt any of those things, you are also supposed to go and you get checked up so that you be sure. Some people fear coming to hospital. Be like, what if I go there and they tell me my blood pressure is so high? Actually, very many people fear because be like, you would rather live on not knowing. But I want to tell you, if you have a high blood pressure, whether you do it, whether you go to hospital or not, whether you do anything about it, if it's there, it's there. Now the challenge with not knowing is you will be at risk of getting other complications. And yet if you had found out, you would probably do something about it. Even when you don't do anything there and then, it will keep in your mind that, oh, I actually have a high blood pressure, and at some point, probably in future, you will feel the necessity to do something about it. If you come to hospital for a wellness checkup and we don't find anything, we shall not give it to you. We shall not say you have it when you don't have it. And it is safer to live knowing that you don't have something than living thinking you don't have and yet you actually have. The process of measuring blood pressure is not painful and it is very quick. Within 5 minutes, we have measured it and we have told you the results. It's not like those other tests that involve taking off blood, things that are so painful, or results that have to be waited for until maybe about 2 days. We shall not tell you to come back tomorrow. We shall take your blood pressure and tell you the results there and then. If there is need, we might tell you to first relax a bit, maybe for 15 to 30 minutes, and then take the blood pressure again. And if we are not convinced by the results, we can tell you maybe come back tomorrow by but 1 or any other day that you find convenient, and we take the blood pressure again. It's just about 5 minutes and the blood pressure is taken. I just encourage everyone to have your blood pressure checked at least once in a while. Why would you spend a whole year without having your blood pressure checked? Because men have very poor health-seeking behaviors, very poor. But men are even more at a risk of getting high blood pressure than women. In Uganda, out of every 4 men, 1 of them has high blood pressure. Out of every 5 women, 1 of them has high blood pressure. That's quite a big number. That out of every 4 men you find anywhere, 1 of them will be having a high blood pressure. But majority of them actually don't know. And the most important step in managing high blood pressure is actually knowing that you have it. If you don't find out that you have it, it means you are not going to do it. You're not going to modify your lifestyle. You're not going to take precautions because you are ignorant. You don't know that you actually have it.